Well, the coronavirus has hit South African shores. That's how we got into the weekend. Health Minister Zweli Mkhize says South Africans should not panic. He says the health system stands ready to tackle and control the spread. Our reporters are on the ground to get us much information for us on any new developments. Monique Mortlock is at the Tygerberg Hospital in Cape Town. Monique, thanks very much indeed for talking to us. Sunday morning and news that coronavirus has arrived here. What can you tell us from that part of the country?
Yes, Stephen, here in the Western Cape, we haven't had any confirmed cases of COVID-19. Last week, we heard from Western Cape health officials just before the Minister of Health did his own briefing in Parliament. We heard from Western Cape health officials that all systems are in place here in the Western Cape. All those major ports of entry are also being monitored, like Cape Town International Airport, where thermal scanning is taking place and other measures are being put in place. And earlier today, we spoke to Health MEC Noma Frenchumbombo just to chat to her about how ready the Western Cape is should COVID-19 hit the province. And this is what she had to say.
The systems are all in place, and also we are now in the provincial joints where together with the Department of Local Government for Disaster Management and other spheres of government, specifically here in Cape Town for the Metro. But I must also indicate that Tygerberg is just designated in terms of a quarantine, but people can be tested anywhere else in all our health facilities, because all the tests that go to the main lab, to the NICU.
All right, so the readiness looks like it's in check. But, I mean, of course, you will get that state of fear, that apprehension, Monique. We've seen that in KZN. We've seen that in Johannesburg. What's the general feel like with the residents in Cape Town?
Yes, Stephen, this is something that the MEC was adamant about, to just dispel those concerns, that panic. The MEC said that just in previous instances of similar viruses breaking out or diseases, like you'll remember the H1N1 flu, a similar panic setting in back then, SARS, the Ebola, all of that. And just like in previous years, the Western Cape Health Department dealt with that. They, just like the National Health Department dealt with that. And just to give you an idea of the panic that we've already started seeing setting in over the weekend, there were unconfirmed reports of a patient who had told doctors or health practitioners that he had come from China, and the MEC said that he had done this, he had lied about that, just in a bid to jump the queue to be tested first, because as you know, Tygerberg Hospital is one of the designated treatment centres, one of those 13 in the country, and they are testing, people can volunteer themselves for testing, or one sample gets sent in, these samples from health practitioners get sent here for that testing. But as I mentioned before, there have been no confirmed cases of COVID-19 in the Western Cape, and the MEC was adamant to people to not resort to what this patient did in trying to jump that queue, in lying about his travel history. She said that this is unnecessary panic, and last week when I was in the shops, I saw this for myself, where we have seen an increase in demand for products like hand sanitizers, face masks, wet wipes, even cleaning products, and the retailers are seeing this, and it's the same type of panic that we saw even in other phenomenons, like when the Western Cape went through its drought and people were also stocking up on hand sanitizers. So it seems it's a pattern where when people feel panicked, they resort to stocking up on these various items. But as we heard from the health department, which you mentioned, and as we heard from the Western Cape MEC, there is really no reason to panic, just for people to be alert, stay alert, and report any symptoms that you might have. Go to a doctor, self-isolate yourself if you're feeling those symptoms of a fever, cough, flu-like symptoms like that, just to be better be safe than sorry.
Monique, I suppose presumably one would question what the foreign or tourist behavior is like in Cape Town, given the fact that that particular airport is a gateway into many of the tourist scenes in South Africa. Do you get a sense that visitors and tourists are also on the sort of apprehensive trend, or is there no visible difference on the tourist front as yet?
As yet, there isn't a frenzy. There isn't really a large-scale feeling of panic among tourists, because over the weekend I was in at the waterfront and along the Sea Point Promenade. Didn't really see what you've seen in places like your airports, where you see tourists walking around with face masks. I saw maybe one or two with a face mask on, people who you can see they're not from Cape Town. But like the MEC mentioned when I spoke to her a bit earlier, she said that we need to be careful of the stigma going around, where we're looking at certain nationalities in a different way. Maybe people from China are experiencing that. We've seen it in various reports where shops run by Chinese nationals, they're not seeing that foot traffic as they would have normally, because obviously of people's concerns. But the MEC also mentioned that this is also unnecessary, the stigma that we may have, and she urged caution against that type of behavior.
All right, thanks very much.